What's good? Amy Paffrath, what's good? She always brings us something good, and we're going to do so now. It involves your health, affordable health care. It's on a lot of Americans' minds this election year, right? Well, there's no quick fix to the issue. One industry leader, Claris Health, is taking public health into their own hands. Our Amy Paffrath joins us in studio to take us inside Claris Health's mobile clinic, Mama Clara. I love the name. How are they doing this, Amy? Nice to see you.
Nice to see you, Giselle. Well, I met a young woman living at the Dream Center in Hollywood who needed medical attention. Now, she didn't feel comfortable telling me the specifics, but said it was related to careless behavior when she was using drugs and alcohol. It's difficult for her to get to a clinic now, but Claris is solving the problem for her and many other women by bringing the clinic to the patient. Going to the doctor can be nerve-wracking. Claris Health is making the experience a lot more comfortable and personal for patients like 22-year-old Sierra Denham, who recently moved to Los Angeles from Northern California to seek treatment for drug and alcohol abuse. She doesn't have any of her medical records and doesn't know how to get them. Enter nurse Abby Clousing. She realized Sierra's struggle and went the extra mile to get the information.
When I realized the situation, it was much easier for me to do as much as I could for you.
Thank you.
So that's what I'm here for. I'm here to help.
It's nice to know that there's people that are like caring and that actually like go out of their way to do extra things instead of just go through the motions.
CEO Talitha Phillips says that's just Claris's unique model of care.
Letting them feel as if they're the only person in the world, whether that be for 20 or 40 minutes. That's been Claris's philosophy this whole time.
That's how Sierra felt. She says she's needed medical attention for a while, but was high when she last saw a doctor.
Like, I feel so relieved right now because I didn't know, and I don't know really what the doctors told me when I was in Northern California.
Take a deep breath for me.
The mobile health staff are aware of the special challenges their patients face.
They come to us already in a vulnerable state, and being able to bring the mobile into different neighborhoods, we're able to, bring the care that they need right to them.
The trailer, playfully dubbed Mama Clara, visits 27 stops per month all over Los Angeles and provides free STD and pregnancy testing, health screenings, OB ultrasounds, and gives referrals for everything else, like they did for Sierra. Though she has a long way to go toward her recovery, getting a handle on her health is a big step forward, which she says makes her family back in Northern California proud.
I think for a long time they saw that I wasn't giving myself many chances, and I am now, and they see that and they're so proud.
For Claris, it's all about giving patients a chance to really be seen. Claris has been providing life-changing services to women, men, and families before, during, and after pregnancy and sexual health choices for over 40 years. They also have 2 freestanding clinics in Los Angeles, one in West LA and one in Inglewood, in addition to the mobile clinic Mama Clara.
How is it funded?
So they have a lot of different ways, mainly donations and their big annual fundraiser and a couple of grants. They also just did a very successful 24-hour campaign in which they raised $200,000.
And how do people find out about where it's going to be? And do they need to make an appointment? And do you just run down the street chasing
No
the
appointment
van?
necessary because,
Really?
yeah, no, you can just show up. They have their calendar is on their social media at Claris Health. Also online at clarishealth.org. You can find the downloadable map about all the different regions. Or if you're in one of those 2 areas, you can go into one of their freestanding clinics as well.
We're always talking about if you can't go to them, bring them to
Bring it to the community.
And for
Make it
young
easy.
people, I love seeing this. Young women taking advantage of it, but I'm thinking for seniors too. You know,
yeah.
people who have a hard time, have little mobility in cities like ours.
Absolutely,
Listen.
and that's exactly why this was created. And for the homeless, it brings the clinic to areas where they're underserved and they need this.
What do you always say? You got to meet
people where they are.
Yes,
gotta meet
very
people where they
true.
are.
If we can have Instacart and we can have
Yes, you're
saucing
right.
and all these things that deliver to your doorstep, we might as
Yeah.
well enter the new economy when it comes to nonprofits as well. And
Especially because you can go
Outreach.
online and it tells you where it is and you can hook up with the location.
It's very easy. They're making it simple and affordable and accessible.
Well, always great to hear your
Yes.
stories, Amy.
Great
And
to see
next
you
time, bring that
guys.
baby back.
I know, like 6-month-old baby.
6-month-old baby.
Already.
I know.
All right,
Amy
thanks, Mike.
Paffrath.
always
good to
bringing
see
us
you.
something good.
to see you.
Nice to see
Thank
you.
you.